So let's begin. Again, my name is Dr. Abel Adegoke. I'm a primary care cardiologist and I'm a GP or general practitioner. And all the introduction that have been made about me. So let's go to what is COVID-19 pandemic and cardiovascular diseases. COVID-19 is the short form for coronavirus disease 2019. And the 2019 is the year it was discovered, and it's caused by a novel virus called SARS-CoV-2, which is severe acute respiratory syndrome coronavirus 2, which then means there's coronavirus 1. Coronavirus has been in existence for a very long time, but this is a novel virus. Pandemic is global outbreak of disease that is infectious, which is evidenced by severe morbidity, that is how badly people get ill, and mortality, how many people die from it. It's usually from spread of disease easily from person to person across the world. And often, like I said, is an infectious disease. Cardiovascular disease. Cardiovascular disease, I know our topic says cardiovascular health. The only way I can describe your cardiovascular health is to mention these cardiovascular diseases. And if you don't have them, then you have a good cardiovascular health. Or if you can control them, it's a way of improving your cardiovascular death. There are diseases that are caused as a result of disorder of the blood vessels and of the heart itself. We have 5 of them, but the common ones are the coronary heart disease, which tend to lead to heart attack. We have the cerebrovascular disease, which tends to cause stroke. And we have peripheral arterial disease, which cause lack of blood flow or circulatory problem to the legs and arms, which is one of the commonest reasons for amputation. Then in our developing countries, we have rheumatic heart disease, which tends to lead to damage of the heart valves. And then we have congenital heart disease, which are the diseases that you have at birth relating to the heart. And the last one is what we call venous thromboembolism or clotting, blood clot. Either blood clot in the lungs, which we call PE or pulmonary embolism, or clot in the leg, which we call DVT or deep vein thrombosis. Let's look at some key facts about these two diseases as we go along. COVID-19 is a new and infectious disease that is transmitted from person to person. Currently, it affected about 213 countries in the world, and more than 30 million people have been diagnosed with this infection, and about 1 million people have died from it so far globally. It affects the lungs primarily, but can affect other parts of the body. These are what I call the extrapulmonary manifestations, like heart attack, stroke, seizures, liver damage, kidney damage, tummy problems. And it kills by causing multiple organ failure through a process we call cytokine storm. Currently, as of today, there is no specific treatment identified yet, and there is no vaccine that has been developed so far. A lot of work is going on in the research-wise to understand and maybe find any specific treatment, and a lot of work is going on for vaccine trial. for development of vaccines. But coming to the what we call cardiovascular diseases, they are non-communicable disease, which means they don't get transmitted from one person to the other. You can't catch it from somebody else. Number two is that they are the commonest cause of death all over the world. Even as we're talking about the COVID pandemic, more people are dying from cardiovascular disease than anything else. It's responsible for over 31% of all deaths worldwide. Unfortunately, 3/4 of death from cardiovascular diseases are from low and middle income countries like our Nigeria, for example. The very good thing about them is that they are very, very preventable. They are preventable by healthy lifestyle. If you detect it early or find the risk factor and you diagnose those early, the outcome of cardiovascular diseases tend to improve. I will mention some of the risk factors for development of cardiovascular diseases. I divide them into modifiable, that is the factors that you can change, and the non-modifiable factors, the ones that you cannot change. So the modifiable factors include unhealthy diet, the kind of food you eat, the quantity of it, and how you eat your food or make them can lead to development of cardiovascular diseases. If you are not active, if you are physically inactive, then you are preparing yourself for development of cardiovascular diseases. If you smoke cigarettes or other harmful products, like other drugs, cannabis, for example, you will likely develop cardiovascular diseases. Or if you use alcohol in excess, then you're preparing your body for development of these cardiovascular diseases. Now, the non-modifiable ones, the ones you cannot do much about, are your age. And I usually tell my patient, what you are today, by next year, you will have gone older or grown older. So age catch up on everybody. Don't think you are young today and you can do what you like, because you're going to get older. A family history or genetics. If your father or your mother have diabetes or hypertension, if you don't watch out your lifestyle, you're likely going to have that. And if you are men, it's more commoner in men to have this disease than in women. All these risk factors, they lead to conditions that are strongly associated with causes of CVD. These factors these conditions are hypertension, high blood pressure, diabetes, high cholesterol, and obesity. If you are too big, they all have, when you look at each of these conditions, one thing they have in common is what we call atherosclerosis, which is what you can see on the slide, the thickening of the blood vessels, because they are the fat and other things that clog the blood vessel lead to narrowing or even lack of blood supply to the organ they supply. So this is a coronary artery that is blocked. We took this from somebody who died from heart attack. Now, I'll quickly talk about the relationship between COVID-19 and cardiovascular diseases. It's a bad relationship. It's actually a terrible relationship we have, and is bidirectional. Because and your cardiovascular disease make coronavirus disease worse. So CVD, which are the cardiovascular disease, it increases your susceptibility and the severity of developing COVID-19. So the common comorbidity, the common problems that people who tend to have COVID-19 have are cardiovascular disease. And people with cardiovascular disease, when they have COVID-19, they are more likely to die from it. On the other hand, COVID-19, as I mentioned earlier on, causes heart attack or injury to the heart muscles, irregularity of the heartbeat, which can lead to stroke. It can cause heart attack and clot on the lungs or in the legs. The other problem is that there are some tablets that people with cardiovascular disease could be taking that could affect COVID-19. We don't know this yet. So we don't know whether it's going to help or not, but we need to keep that in mind. So how do we help ourselves with regard to cardiovascular disease? How can we improve our cardiovascular health? Well, the main answer is healthy lifestyle. You have to have a healthy lifestyle. And to do that, healthy lifestyle is about maintaining your health. If today, as we're speaking, your health is not good, don't panic too much, but if you start healthy lifestyle, it will not deteriorate. However, healthy lifestyle will give you the chance of actually preventing yourself developing diseases. So what does healthy lifestyle involve? One, it involves food and nutrition. The type, the quality, the quantity, how you make them, they are extremely important. And I'm very sure that at some point, we are going to have another webinar that will specifically address this issue. The second point is physical activity. So you take in food to generate energy. If you don't burn off the energy, it's going to lead to problem of obesity, problem of excess blood sugar, excess fat in your blood. So one of the ways to get rid of the excesses is to be active, exercise, work out, jog, run, strengthen your muscles, stretch your muscles. All those will change your body dynamics and improve your cardiovascular health. An important one is your weight control. Make sure you are not obese. Make sure that what we talk about weight, we want every dimension of your body to be commensurate with your weight. In other words, don't have a pot belly. It's not good for you. Don't have too much backside. It's not good for you. Everything must be proportional. Your height and your weight must be proportional in order not to create problem for yourself. And one thing about healthy lifestyle is it's not something someone can do for you. You can talk about it, you can sing about it, you can hear talks about it many times, but unless you get involved, you need to do it. You need to carry out activities yourself. And it's not something you do around Christmas or immediately make a New Year resolution and do it for 1 week or 1 month. No, it has to be consistent and throughout your life. It mustn't be sporadic. So how do we prevent CVD? You can hear from what I've said. You need to control your body weight. You need to maintain a healthy lifestyle, be physically active, eat the right food in the right quantity, avoid excess alcohol, and don't smoke. And if you do smoke, then try and work very hard to get off it, because cigarette smoking is one of the major causes of health problems worldwide. And finally, if you are hypertensive, you need to control your blood pressure. It's not something you do now and again. If you have high cholesterol, you need to control that. And if you are diabetic, you need to control your blood sugar. Things to remember as I close and give opportunity for us to ask questions is that it is not late for you to start. Take action today. The other thing is, if you have health issue, talk about your health issue. Don't be embarrassed. Don't be shy. Don't hide it. Speak out so that you can be helped. Don't be overwhelmed by all these things that we're saying about lifestyle. You can start small, and a small change add up to become a big result. Here, where there are screening opportunity, get screened for blood pressure, for diabetes, for high cholesterol, so that it can be managed immediately. And know and use your healthcare givers, your doctors, your nurses, ask questions from them. So as I finish, I will say that for COVID-19, we need to live a good hygienic lifestyle and follow the advice by the scientists. Please don't take in so many different information, theories, conspiracy theories that people are saying. This is a real problem. And so wash your hand, wear face mask, follow social distancing rule, be strict with your hygiene, and also make sure that you remain healthy. Watch what you eat, what you put into your system, be physically active, find time to rest, and avoid unhealthy lifestyle. Comply with prescribed medication and go for screening tests. Thank you. You can now be asking your questions, and I'll be able to answer them as much as the time permits us.